All right. Good evening, my friends. Let's see. All right, let's see. All right, I think I'm getting good with this. I am getting good with Instagram. Awesome. Join me, folks. I look forward to seeing you. All right. I believe I have invited our guest. And all right. Awesome. Hello, Dr. Daisy. I think you're waving. I'm going to wait for you to accept because I'm not that great with Instagram. Let me take a look. You should be joining. So, unable to join. Dr. Daisy, unable to join. So I'm going to wait for your request. Let's see. I do see it. Okay, let me accept. It's always challenging for me with this Instagram because I believe it has a mind, all right, of its own. Hello there.
It was taking a little bit of time.
Yes, and you know what? I was just saying, the social media and Instagram, like I really have to get more familiar with it. But thank you for joining.
Can I give you a suggestion?
Yes.
All I see of your head is like this.
Yes.
Can you go up or down?
There we go.
Much better.
Okay. I'm fixing. Let me see.
I learned that trick that whoever is starting first, like their head like moves like a ship.
Yeah. What I can do is lower. How about this?
Much better.
Much better. There we are.
Yay!
So we do have some followers. So welcome to the Stirrup Sisters podcast. We have Dr. Daisy Anglow. And yeah, I am so excited. First of all, before we even jump into the conversation, I am Nurse Jessie, one of the co-hosts for Stirrup Sisters podcast. And do you know who is not going to be joining us? Nurse Christy. She is in the air on an airplane, flying from major city to the next major city on business. So she does send her love to you.
Thank you.
And before we get into it, because I really wanted to just see, how are you doing? How was your work week? Like, let's catch up a little bit.
I'm so busy. I have been traveling so much for conferences as well. So it's like conference season, I feel like. I mean, as like clinician, it's always conference season, but I always put mine towards the end of the year for all my like continuing education at the same time. So I'm working really hard. So yeah, I've been busy with patients this week. I mean, my biggest work is women's health. So a lot of young women coming in, asking about birth control options for them, natural birth control options. I'm like, do you have a good partner to talk to? Because when you do natural birth control options, you have to have a very understanding partner.
Yeah.
Otherwise, you'll have maybe 9 months.
You know what? And this is why we love to speak with you, Dr. Anglow.
Yes.
Because for myself, as well as Nurse Christy, we really want to educate young women, pretty much women of all ages, and men to understand women. So before we jump into the Thanksgiving talk, but this is really why we have you on, is women below the belt health. So talk a little bit about maybe the options for natural. And I actually was going to introduce you, like to give your full title, but why don't you introduce yourself?
That's the worst. Hi, everyone that's listening. You better be joining and staying for the whole time. We're going to have a fun chat. I am Dr. Daisy Anglow. I am a naturopathic physician. So my practice focus is holistic health, helping women get control their body's hormonal health and gut health again with a more natural approach as possible. So we work on lifestyle changes, we work on diet changes, and again, if medications are warranted, then we'll add medications in as well. But we really try to get back to the root cause of what's happening to your system and helping you understand your body better, helping you love your body a little bit more too.
Love it. I love it. So women coming in to see you, Dr. Anglow, and they are asking you, Dr. Anglow, what could I do for birth control, but I want it to be natural?
Yes. So that was a conversation today. Like I was talking to her for the whole almost 90 minutes. And at the end, she's like, well, I have this one extra question to ask you. And I'm like, oh, women always get so shy, even asking another female about anything sexual in nature. I think it's like just how we grew up. Maybe it's religion, it's taboo, but I don't know. Like I think I'm looking at her and thinking, oh, she's so young and only in her early 20s. Of course, she's going to feel weird asking about sex or even natural options. And I'm like, well, first of all, do you have a good partner? Because at the end of the day, it's a partnership. And if you choose not to go on birth control, condoms are always an option. I know it's only 99% effective, but they do work when used properly. So that was an option. And again, she also happened to have PCOS. So I'm like, okay, let's work on understanding your body's natural rhythm first, because if you're not ovulating, chances are you will not get pregnant, no matter what, how many times you have that. But if you are ovulating, when is it happening? So we need to now track your body's natural rhythm. So I was teaching her about basal body temperature. I'm like, okay, every morning for the next 3 months, just take your temp. I know it's not like super fancy, but that little change in body temp means there's likely ovulation happening. So you need to start paying attention to that, because I'm sorry, but the apps, while they're helpful, they're not always accurate.
They're not always accurate. You're so right, because key messaging of what you just said is we have to learn our body.
Again.
Because yes, there are apps and other resources to help guide us, but without understanding your own body, right, then we could probably see ourselves in a revolving cycle that we don't want.
I know. So I do believe that the whole natural birth control approaches, family planning really do work. But again, it's the partnership. If there's no communication, if there's no understanding, hey, babe, I'm ovulating, let's not have sex tonight. Like, that's not going to work. No matter how much you do, you have to have someone that's also understanding and willing to help you navigate your body's own processes too.
Yeah, yeah. So getting to the topic of Thanksgiving. Yeah, I'm waving to our folks here. So is there, hey sisters, hey, Pink's Goat, hey, that's my girl right there. So is there any topic that's off limits during Thanksgiving? And this is like talk around the Thanksgiving table. You know, like we're women, and when we come to the table, we can be formal, or when it's family, depending if we like our family, right, Dr. Anglow? That's another
conversation.
Another conversation for Thanksgiving. Do we like who's coming over for dinner? And is it a good time to talk, and then that talk leading into education, or hopefully, or is there a way to ease into education around women's below the belt health?
Yeah, it's tough. I feel like as a young woman in my early 30s, every time it's, when am I getting married? Am I gonna have children? I'm like, don't ask me that. It's happening when God says it's going to happen. So let it be. So it's tough, because you can have your own opinion, and no matter what, it's who you're talking to. How are they going to respond to what you're saying, right? Especially now with how things have transitioned so much in our country with abortion and all of that. It's like, some people are just really strong-headed about it, and nothing you're going to say to Uncle Steve is going to change. And generations and who you're talking to, you have to understand your audience,
Yeah.
right? It's almost like comedy. Who are you speaking with? Education, no matter how many PhDs you have, you know. And Sophie might just be the coolest aunt ever, but she's really stuck in maybe her religious beliefs or how she grew up. And whatever you tell to Aunt Sophie, her casserole is good, but her views and your views are never going to match up. But you still have to have your own voice and have your own conviction and feel strongly about what you're going to say. But I think you have to also be delicate about who you're talking to, making sure you're sensitive to where they come from, because that is number one, being sensitive to where they come from, and still express yourself in the most respectful way, all the while knowing that it might be well received or not.
Or not. And I get the feeling that maybe men don't want to hear the woman's health talk. Myself and Nurse Christy, we were in Miami together for a conference, and we got into the Uber together, and we had a wonderful gentleman that was driving us to where we needed to be for the conference. So we're like, hey, you know, we're the Stirrup Sisters podcast, and we just have a question for you. And I hope Nurse Christy will post it soon. But are you married? And he's, yes, I'm married. It's like, okay, great. How often do you talk to your wife about her woman's needs? He got nervous. What do you mean? He started to get a little anxious. What do you mean about that? And we're like, exactly. You're starting to get a little anxious. How often does your wife ask you about your health? Oh, it's all the time, he says, every day. And she's more worried about me. So then we asked him, how often do you ask her? How is she feeling? Have you spoken to her about below the belt health? And he would say, no, she actually will ask me. So when patients are coming into you, Dr. Anglow, do they come alone? Do you see both men and women? What is your practice like?
Yes. So whenever patients come to me for preconception care, I do hope that if the female patient comes first, that her husband also follows. I make sure she understands that fertility is a two-person's game. You could be doing real well, but if your husband isn't, nothing is going to be magic and work, right? And then I have some women who just send me their husband first and then they come after, or it's vice versa. But I do believe that if it's a sexual wellness, I hope that both partners come in, because sexual pleasure in women is as important as sexual pleasure in men as well. And I think almost always when a male patient comes to me, it's a below the belt situation. Erection's not doing so well, libido's not as strong, they don't look or feel their best, so they think it's impacting like their partners, how they see them, and that also impacts, you know, sexual health and intimacy. So that happens. And when women come to see me, if they have below the belt issues, whether it's actual pain during intercourse, vaginal dryness, sometimes they won't bring their husband with them. They'll have them sit in their room, and then after we have our first talk, then they'll come in to chime in. I do believe, because it's a partnership, it's really nice to have both partners in the room, to kind of have the wife listen to her husband and vice versa, to really have like, okay, is this an actual hormonal thing, a connection thing? Is this like a me I can help you with, or like a therapist can help you with? I sometimes don't know until I'm actually sitting and meeting with them. But I do hope that men feel confident enough that they can come in the room and know that their needs are also going to be heard, even if it's a female practitioner.
Right. And I feel like it is important. I am a registered nurse. Of course, I'm working in the clinic, and it is very, how could I put it? I just don't want my computer to die. It's very easy to have a conversation regarding sexual health with the male. It is almost as if the physician is ready to provide, even if the male does not request for the education.
Interesting.
Absolutely. And I've seen it. And now that I'm working, I first worked in ICU, intensive care, cardiothoracic surgery, and all of the intensive care units. Now I'm working in oncology, really more, I would say, heart-wrenching, you know, and more of a, how could I say, more in deep or in-depth type of nursing care as far as connection, relationships, feelings, and really advocacy for patients. So I say all of that to bring up the point that women and women's sexual health within the clinic, it's tabooed. It's almost as if the maybe the oncologist or the medical doctor, I just handle the disease process. I don't do that. Like, where's the nurse? Maybe find them resources. I'm done. But that's what I witness. That's what I witness as a nurse, just caring and supporting the patients, that it's so much easier to have the conversation regarding males' sexual health. But for whatever reason, it's like, we don't want to talk about the woman's sexual health. It's too uncomfortable.
Yeah.
So think about that. And then my follow-up question for you, being that it's the theme for Thanksgiving, how young or old do you think for a young woman to receive education? Like, is there, because I think I have an idea, but is there an appropriate age? So the first part of the question, during clinic, maybe I think your colleagues working in clinic, what do you think they would say if you were to ask them, do they have women's health or women's sexual health conversations just as often as male sexual health?
Yes, I definitely think, because I used to work in a predominantly female clinic, even though we had a significant amount of men coming in, I do believe that they are very comfortable talking about it, solely because we do hormone health. Right. Hormone health is pretty much sex all the time. It's hormones, it's below the belt things, your erections are not coming in when you want them to, testosterone is going to help. So I don't believe that it was as taboo, solely because they knew they were coming in, they want the help, they need to be open about their sexual health and wellness. Mm-hmm. Again, it's practitioner to practitioner as to how comfortable and how open that patient is going to be with them. But I do think, I used to work with some really cool people. They're just like super chill. So whoever was in that chair felt really comfy to just be like, okay, doc, this is what's happening to my body. Let's talk about it, kind of thing. As far as the age is concerned, I do believe as soon as a woman is menstruating, even honestly quite before, we need to educate her about what's happening and what's going to happen to her body, so that she leans into menstruation, not so afraid of it. Because every time I talk to a woman that's afraid of her menstrual cycle, it's whatever she was told as a young girl about, to fear it, it's dirty, or now she can get pregnant. So it's about leaning into your menstrual cycle, not fearing it so much. So I do think my young girls who come in, I ask them about like what's happening with their bodies, they have changes, and they are really open, and they'll just tell me how it is. Sometimes their father is in the room, sometimes it's their mother in the room. And I've seen parents just say, well, just tell her what's going on. And I'm like, okay. I just love when parents allow their children to speak for themselves, versus what they know it's happening, but they'll just speak for them. So yeah, I have young girls coming to me. I am really careful with my choice of words, because again, it's still a child, right? Don't want to scare them too much. But I'm careful with my choice of word, but I still want the 8-year-old to be as educated as a 12-year-old or a 16-year-old, just in a different way about different stages of their lives.
Yeah, I actually have the same, I would say, desire to educate. I feel like young women should begin to feel comfortable about talking and getting ready for what is to come. At least having them be comfortable about the conversation and to know what to expect, what is their normal. Of course, if something were to be abnormal, that they would be able to identify, or at least, it would set an alarm. You said something very interesting regarding like now today's women and young women, they're more open. I do see that there is a different generation out there, and I absolutely do embrace it. Also, and I see something from Pink's Goat, but I'm gonna say Pink's Goat. I'm gonna say what I'm gonna say first, and then I'll read it. So when my girls, when they were younger, they're adults now. I have two beautiful young women, but each of them, when they had their first menses, I purchased a cake and we celebrated.
Congratulations!
We celebrated. So it was red velvet. I have no idea why I chose a red velvet cake with the ice cream from Cold Stone Creamery.
Oh my God, yummy!
And it's like, oh my goodness, let's celebrate this, because this is not like, oh no, I got my period for the first time. Yeah. It's like, no, this is awesome, because this is supposed to happen. Mm-hmm. So what are your feelings about that while I read this?
Yeah. Honestly, I think it's so wonderful. I left home really early on, so I never got, I think, that conversation. I went to boarding school at 10 years old. So I never got in that conversation. And my brother dropped me off at boarding school and bought me like a bunch of like pads. And I was like, I have no idea what this is. Honestly, no idea. Why he buy it for me? I don't know. But he bought them for me. He's like, oh, you're going to need that in the future. I'm like, okay, I don't know what it is, but I'll just have to keep it. So when I actually had my first period, I just didn't know what was happening to my body, truthfully. I thought I was sick. I thought something was going wrong with me. I hid it for so long, using like paper towels in there for the longest time. I think for almost 2 years after I had my first period, I actually knew what was happening to my body. Because I hear girls talking about tampons, how to put a tampon in there, and I'm like, oh, this is so scary. Where are you putting something in there? Because all I knew was tampon was bad. It's going to make you not virgin anymore. And I'm like, I need to be a virgin. I'm Catholic. Like, I think my upbringing was so religious that for me, it was just all negative and like bad.
Right.
And I don't have children, but I hope when I do, and if I do have a daughter, or even a son, still educate them about what's happening, and it's totally normal. And heck, even get a red velvet cake on it, because why not?
Absolutely. So from Pink's Goat, listen, the education on the female body and health is a bit behind. One of my pet peeves is that during our normal GYN appointment, Kegel strength should be assessed and discussed. What are your feelings on that? I totally agree.
One of the biggest things I always say to my young women is that the biggest issue I have, even with the education system, our sexual education system has been still a little bit more religious. It's about not getting pregnant. That's it. There's no true understanding of helping the women who actually are getting pregnant about their body, right? What's happening, why it's happening. It's like, okay, sex is bad and that's it. But understanding your period, even, it should be honestly part of sexual education. Yes. So you'll understand what's normal, what's abnormal, and what to look for outside of periods, discharges, UTI, all the basic things. And yes, Pink's Goat, I think like even Kegel strength, just pelvic health in general is not talked about enough, because Kegel is one of them. Proper exercise for your pelvic health, because below the belt means again, of course, all the organs, but also strengthening that pelvic floor so you don't have, UTIs or urinary issues when you're sneezing and laughing or coughing. Kegels are great, but pelvic health is just so much more than Kegels, and I don't think many people know that.
It's true.
Many even know how to perform a proper Kegel to begin with. So yeah, I don't think it's educated enough. I do think gyne appointments beyond the pap smear and the wild woman exams, like, okay, you're good, you don't have HPV, bye. But what about my peeing every time I sneeze, what about like all this extra things that need to be part of the appointment? But again, insurance won't bill for that or code for that. So yeah.
Yeah. I was just going to say, how realistic is it? Because my yearly GYN appointment, I go in for the appointment, and you are so right. HPV screening, of course,
Mhm.
I do want it. And even my GYN was actually telling me, well, since it's been normal for the last 2 years, I think we're going to. And I said, no, I want it annually because we just don't know. So that's another thing. What if young women don't really understand that they should have a yearly HPV screening done? And insurance companies are trying to, I would say, lengthen the time between your screening if you are showing normal HPV screens.
Yep.
So, what are your thoughts on that? Because that just popped in my head.
Yeah. Interestingly, I have a patient I have worked with for almost 5 years, and now her HPV screening, everything has been perfect for since I've known her. New partner, new screening, poof, it's positive.
Mm-hmm.
And mind you, if it was the same guidelines as before, where okay, you don't have to wait forever. Now she might be now getting pregnant in the future, not knowing that she was HPV positive because she was constantly told that she was fine because she was fine. So I do believe new partners definitely do get tested. I think people forget that. You can never trust the man. I'm sorry, you
You know
can't.
what? We're professionals. You are a doctor. I am a nurse. We hear the stories. We see what's going on out there. And I'm going to echo you, Dr. Anglow. You cannot trust your partner. I've seen with my own eyes, you know, partners that will not tell the truth in front of their mate.
Yeah, and
Patients
then
that won't tell the truth.
and it comes up on labs, and you're like, I'm only with my husband. Okay, that's fine, but is he only with you? And
Correct.
that's like makes me so sad when I have to tell a woman that, because I know that no matter how faithful she is, if there's one time that your partner went somewhere else, now you have HPV, and then now you have to talk about it. And so it was kind of heartbreaking because I'm like, it's 6 p.m. She saw her labs. Her guy would not call her. I'm like, hey, I can call you right now. I'm about to have dinner, but I just want to call you so you can feel good about sleeping tonight. But it's just heart-wrenching, and you have to take care of your own body. You can never let it to your partner. I don't care how much you love him. I don't care. Take care of yourself.
Right.
Your
No,
health is important.
I'm very happy that you actually did mention that, because it is a sticky topic, sticky subject, especially that we are advocating for the patient. And if we're caring for the patient, and maybe the patient's partner or spouse will come up to you and say, I want to know what those results are. I'm already probably sweating at my armpits because it's like, oh my goodness.
I know.
Did you speak with, your
Yep.
partner? Why don't you go and speak with your partner? Like, I can't reveal anything
No,
without the permission of the
exactly.
patient. But it's killing you inside because you know for sure there's, whatever going on, that it's not fair to the partner. So that's the dilemma for us healthcare professionals as well.
Yeah. For sure. That I feel like if you're gonna have, exes come back around Thanksgiving tables during the holidays, they know stuff and you may not want your partner to know. So make sure you text them before. Don't mention that one thing.
So far, we, I think, are agreeing that around the Thanksgiving table, it's okay to talk about women below the belt health. Pass the turkey and the stuffing, and let's talk about menstruation.
Menstruation, all the things, masturbation, all the taboo things, I don't know. I just think with times things will change. Even what we're naming, women's vulva or penis, like how we're naming it. just the naming of body parts into cutesy words sometimes takes away the power a little bit, but at the same time, it takes away from the education as well, because we don't know what these body parts are called and what it's supposed to look like when things are good or not so good too.
Right. You're so right. I forget where, maybe it was a conference, and it had to do with pediatric patients. And it was really, the topic was, when you are teaching your children about serious issues, especially health, and maybe body parts such as women's sexual organs, the vagina, to call it out by its name.
I love it.
Not create, nicknames like your bum bum or whatever. I'm just making up. And I thought to myself, you know what? That is absolutely true.
Yeah.
And I'll give you a story. So I remember when my little girl, of course, both my girls are women now, but when she was little and she was at the pediatrician's office, and the pediatrician was a male and was doing his normal routine exam. So as he's doing the exam, and I had just turned around for a little bit just to grab something maybe out of my bag. And when I turned back around, she said, Mommy, he touched my vagina. And she was probably like 3 years old. And he was mortified. And I looked at her and I said, I am so proud of you. Good girl. Like, you remembered to talk to me, to tell me. And that was because of teaching her. This is the name. And she remembered. The doctor almost fell out.
It's funny because you mentioned your daughter, because I had my hairdresser just recently. I asked her about like how she's educating her daughters and then what she's using as terms of like wording, and she told me how she's using proper terminology for all her kids. I think they're like 6 years old, 7, and like 18, but like she's using proper terms and they're using these words, because she mentioned how she is never comfortable about her daughter going to a sleepover at somebody else's home, because you never know what can happen. Yet any of her friends can come sleep at her house because they feel comfortable, because it's her and her husband happens to be a firefighter. And again, it's the whole like, if you're teaching your child what's appropriate in terms of body parts, how people respond to them, what kind of respect they should have for themselves, and how men or women should respect their bodies, then they can feel more empowered. If something happens, they can say, Mama, he took my vagina, and then you'll believe it too. Right. You'll believe it because you know that she will not see that unless something truly happens.
Absolutely. And using the correct terminology so that there's no mistake with what is a bum bum or whatever. I don't know, whatever nicknames there are. But there's no mistake in that. And I really stood true to that. And that is exactly, what I taught both my girls. There was another thing that crossed my mind. What was I going to say? But anyway, for the audience, we do have a few guests that's joining, and thank you so much. Any questions for Dr. Anglow? Dr. Anglow, please introduce yourself again for those who probably just joined the conversation. It's like, who are these girls? What are they talking about? So
yes, thank you for having me again on your podcast. I'm Dr. Daisy Anglow. I am a naturopathic physician. My practice focus is helping women and a sprinkle of men that come to see me learn about their bodies, natural processes, hormonal health, and gut health are mostly my focus, but we talk about everything under the sun. And we do have a more holistic, natural approach to health. And if meds are warranted, we'll use them, but almost always working on lifestyle, diet changes first.
Awesome.
Yeah.
Awesome. So if you have any questions for Dr. Daisy Anglow, please put them in the chat. We will read them so that we can get them answered. But Dr. Anglow, as regarding hormone, I just have one question. For women approaching menopause, what hormonal changes can they expect, and how might these changes affect their pelvic and reproductive health?
Yes. It's funny you say that because I just saw an ad for Clear Blue. They have like a new ad now where it's like menopause, you're in menopause. I'm like, wait, from pregnancy to menopause, now Clear Blue wants to take it over the world, truly. But one of the biggest change I think sometimes women will start noticing is the skip in their periods. They'll think it's just due to stress or travels, which is also true, but the changes in mood as well. I'm almost always seeing a change in mood, like they just feel either more anxious or more depressed, and then maybe the periods change also happen. Again, we know about the whole menopausal hot flashes, night sweat. That might not happen as early, or in some women, depending on how soon they are going to transition into menopause, these changes can happen quite early. So these are often common things. Changes in your menstrual cycle, changes in your mood, your energy level, sometimes even weight changes. What you used to do when you were younger to stay fit and lean, now you're struggling a little bit more with that. And when it comes to pelvic health, definitely the vaginal dryness is a big concern. Painful intercourse can also happen. Maybe you might find yourself maybe leaking a little bit more if you've had children in the past, which is why I think pelvic health is so important for every single person. But I do think women need to understand that changes in perimenopausal changes can happen as early as your late 30s, actually, which is why you have to be educated, because they always say whatever age your mother went into menopause is likely going to be your age. Maybe not, because of how much our environment has changed, how much stress we are now burdened with, our diet, our lifestyle. So those are not really true. They say the average age of menopause now is 51. I've seen not to be necessarily true. So I do think women need to know that these changes to their hormonal health may happen as early as 30 years old.
Right.
Because we know that DHEA, which is a very common androgen, will start to decline at 25. Testosterone is going to start declining at 30. So women are like, I don't know why I'm so tired. I'm only 30. Well, you're missing half of your testosterone at 30 years old. So, so even if you don't have children, you're still going to naturally go through these changes. So you have to start paying attention as early as your 30th birthday, I will say, to see like, okay, what's happening to my body right now? It's completely normal, but I need to talk to someone so that I know where do I stand? Yeah. How high are my levels? Am I really approaching menopause? Or maybe there's something else I would need to address.
I'm so happy that you mentioned that. You're really reading my mind about hormone levels. I actually just recently had my hormone levels tested, but I don't know what they were before. You know what I mean?
Oh, yes.
So I don't have a comparison to know, did I begin dropping, because I am in my 40s. Have I begun dropping my estrogen level? So I'm so happy you brought that up. Is there a particular age? And I have no idea if insurance is going to pay for the hormone levels. I don't think so. But how important is it to know maybe a baseline, just like we have baseline blood pressure, baseline cholesterol level? Should we have a baseline hormone level?
I do believe so. I think women that come to see me want their hormones checked because they're actually struggling with PMS and all that, right? So we'll check it, fine. But let's say you've never had issues with your period at all, like myself. You don't know what's going on. Like, things are just always seemingly perfect. I do believe either you will have those levels checked because you're actively trying to conceive. So preconception care will make you test them. But I think like a strong like 25 to 28 range is a good time to get a baseline.
Yeah.
Because things can change within 5 or 10 years right after that, right? Yeah. So if you kind of catch it a little bit early on, you can see, okay, this was me at 30 or 35 without children, whatever, and this is me now. So I do believe like 28, 30 is a good time to check your level.
Awesome.
Yeah. So what do you think?
You know what? I was so curious, and I just being aware of, I'm in my 40s and I'm currently almost done with my PhD studies. It is on women's sexuality after gynecologic cancer. And I just thought, you know what? I would like to know what my levels are. Not that I feel like I'm having a problem. It's just because I don't know. And I've never had my hormones checked before. So now I see a number. I did not understand the number because I don't work in,
Yeah,
GYN.
exactly.
So, and I asked my GYN, is this normal? He said, you're fine. Are you having any issues? And I thought, well, I think I was having hot flashes. I'm not sure. It could have been stress because I, PhD studies, work, travel for work. So I could have been tired. I could have been stressed. But I feel like I would have liked a baseline when I was younger, where I know this is probably when I'm at my richest of or highest of estrogen level, to see if that number or at least the range changed, and I don't have that baseline.
True. Well, again, now you can say you have a baseline now, so in the next 10 to 15 years, you'll see what that looks like if you're actively experiencing physical changes.
Right.
I do know that women doctors will require these tests unless someone says, hey, my period is missing, I'm having hot flashes or night sweats, even in your 20s or 30s.
Right.
And believe me, it does happen in your 20s or 30s. I see women all the time who have low progesterone and they're having hot flashes in their 20s or 30s. So it can happen, but you might just ignore it and think, oh, I'm just too hot. The heater is on.
Right. Yeah. You know what? Let's see. Pink Goat sent a request to be, oh, do you want to be live? Let's see. We have a guest. Let's see. I'm getting good with this Instagram. Let's see if I can have her join.
Lovely.
A live question for
hello.
So I think you're on live with Dr. Daisy Anglow. Can you hear us? We see your ceiling fan. Hello. Oh, I think I hear something now.
It's like with social media, it's always exciting.
How
do you know each other?
Yes, we do. We're nurses. We work together. But I'm not sure if that was a mistake.
Yeah, that happens.
Yeah, and I don't even know how to now remove her. Let me see. All right. I would have removed her. That's okay. Anyone else that may have a question for Dr. Daisy Anglow?
I think it's always, social media is always so interesting.
I know, it's so interesting because I would like to now remove, and I don't know how to. Maybe you can once you've accepted.
You should be able to usually, but it has to be on your side. I don't
Yeah, because I do see, let me just see if I look for her.
I wonder if you go up top where you see the Stirrup Sisters live, the little arrow down, that can do that, but I'm not too sure.
Yeah, but we'll keep going.
Yeah.
We will keep going. Yeah, that's all right. But anyways, any question for Dr. Daisy Anglow? Because I'm about to ask her 5 rapid fire questions. But before I do, any questions for her?
Yes.
We would like to hear from you because we're having a wonderful conversation. And it is okay to talk about women below the belt health during Thanksgiving and at the Thanksgiving table. Whoever don't want to hear about it, get up with your plate and go sit at the children's table.
Everybody uncomfortable is totally fine. There's always one in the room anyways.
Absolutely. All right. So rapid fire questions. Dr. Anglow, what is your favorite food for the Thanksgiving table?
I love sweet potatoes.
Any particular way? Like, do you like with the sweet with marshmallow or
I actually will like have like a tiny little piece of that because I know it's going to my body. But I just love sweet potatoes, like lots of garlic and butter, like creamy, like kind of chunky, not too soft. But yeah, must. Sweet potatoes is a must.
All right. So then what is your favorite dessert?
Okay, so I actually don't care so much for pumpkin pie, but anything with apples, I'll take it, or pecan pies, I really enjoy.
Oh, okay. I would rather do the apple or blueberry pie.
Ooh, yum.
Yummy, 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 yummy. What is your go-to lazy dinner? So you come home
Oh
from
my God.
work, you've seen a lot of patients, and you're like, I gotta eat something.
Salmon, because fish is the easiest thing. My mom always says fish has no lives because you put it on there, salmon with a little salad or salmon with
I
asparagus,
love it.
done.
I love it. What is your favorite type of music, maybe for the Thanksgiving dinner with your family?
Oh
What are
my
you
gosh,
listening to?
I love jazz. So I'm like, I've been looking to Aretha Franklin lately. I just bought a record player, so I've been playing all her records all day and the same songs all day. I love it. Jazz.
Nice. So, and the word is that your dental hygiene has a lot to do with your cardiac. So, how often or do you floss right away after eating?
I don't floss right away after eating, but I've been doing something really cool, which is called oil pulling. I'm not sure if you heard of that before.
No.
So what you do is you use coconut oil in your mouth and you swish it around for some time and you throw it out in the trash, not the sink, when it clog your sink. And actually been shown to have so many benefits. I actually put a video on my Instagram about that.
Wow.
But yeah, it's amazing for oral health because of all the antimicrobial, antiviral agents are in there. So yeah, I love oil pulling, and then just again getting your regular checkups with the dentist too. I know it's scary, but you gotta
Oh,
go.
definitely, definitely. I have heard of the coconut oil in them. I have.
It's
Absolutely.
disgusting, but works
Yes.
so well.
But it does work well, and it does actually pull like the toxins out of your mouth
I
or the
know.
bacteria.
Huge fan.
Yes.
Disgusting, but huge fan.
Awesome. It was a pleasure to have you. Any last words? What is your Instagram handle? How can people find you? Because you are a wealth of knowledge.
Thank
And
you.
we at the Stirrup Sisters podcast love when you are joining us.
Thank you.
So, mhm.
Yes, definitely. If you're rewatching, when you're rewatching this later, definitely reach out to me. I'm super open and easy to talk to. I'm at Dr. Daisy Anglow on Instagram or TikTok sometimes.
Yes. Awesome. And we have a question. Does oil pulling inhibit bacteria growth?
So yeah, there's been a lot of great studies about oil pulling. It's an actually traditional Ayurvedic type of medicine, but it's becoming really popular here. You don't have to get any fancy like coconut oil or anything. You can use olive oil, coconut, or even sesame as well. And it actually is incredibly antimicrobial, antiviral. So try it out. You have to definitely build up to it because it's really uncomfortable. 30-second, a minute, even up to 15 minutes. Some people do it that long when they have like more chronic issues to keep their dental hygiene clean and
Yeah, yeah. I actually, when I first heard about that, I used to do it. And then, of course, with every fad,
yeah.
I drop it. But I do floss. I am like dental hygiene fanatic. So if I feel just a little string in between my teeth, it is driving me insane. I have floss in the car, in my purse, in my makeup bag.
Wait, what kind of floss do you have? The other, that kind, or the like the toothpick thingy with the pick thing?
I don't like the toothpick.
Okay.
I like the string. I like the string. And personally, I feel like the toothpick, it gets dirty faster because you don't have that much of a string. And I believe that you're reintroducing, to me, in my opinion, reintroducing the bacteria from maybe the back of your teeth to the front. However you're going to start.
Yeah, it's true.
Yeah.
Thank you so much for having me tonight.
Yes, you're very welcome. And oh, okay, she took herself, maybe. I was wondering, I guess that was Pink's goat. I am not sure. But Dr. Anglow, Always, always a pleasure. We love to have you. Even Danvers Nursing Institute says, thanks for the oil pulling tip.
Oh, yes.
For sure. Love Glide Floss. Yes. That must be Nurse Christy. She's probably like, you know, in commute right now off the plane. Nurse Christy, we miss you.
Yes. See you next time.
Yes, so see you next time. Thank you again. This was another broadcast from the Stirrup Sisters podcast. I am Nurse Jessie, licensed professional, registered nurse, and I am here with the wonderful Dr. Daisy Anglow. And any last words for them, Dr. Anglow?
Well, go make someone uncomfortable. You might actually save their lives.
There you go. I love it. I love it. Thank you so much. I love that.
Oh, just you plane. Oh, thank God. You got there safely.
Thank you, Nurse